Hello again. Chapter 5, Building an Egalitarian Relationship with a Child, Marriage and Family Play Therapy, Partners in Play, the Terry Kottman text. The first thing is to build an egalitarian relationship with the child, to know if it's going to be a shared partnership between the two, growing out from mutual trust and respect. Communicate respect for and trust in the child and their abilities, earning the respect to trust the child by being considerate, tolerant, and respectful. It's a democratic, collaborative relationship, shared responsibility and power in the sessions. Some critical factors about confidentiality. If it asks the child to draw or tell a story, the child chooses not to, that decision is accepted with respect, and we determine what the child would rather do instead. Meeting and engaging with the child from a philosophical belief that all people deserve respect and degree of power in their life. Adlerian play therapists believe that this tenet is a foundation for the relationship. It's not discrete, it permeates the relationship. Going straight to the child, getting on eye level, introducing ourselves, not going with I'm Dr. Eller, but hi, I'm Miss Shannon, or I'm Shannon. Going to the playroom together. It's time to go to the playroom. Your mom and dad will be waiting for us when we come back. Sometimes the child is reluctant to go. Sometimes the parent can stay in the playroom and observe or sit in a chair in the hall. We do not drag or force the child in there. This is our playroom, and here you can do many of the things that you want to do. Very much a Landreth thought process. What do you think? What have you been told about coming here? It's certainly not punishment. Children with discouraged worldviews sometimes distort and misinterpret the information that they're giving that is punitive. Or they haven't been given any information at all. A Child's First Book About Play Therapy on page 103 by Nemiroff and Annunziata, 1990, might be a book that you can share with children and with their parents. Restating content, reflection of feelings, communicating respect for the child's position and perceptions, and desire to empathize. Children frequently don't acknowledge or respond to statements, so we look for nonverbal cues as a recognition reflex, according to Dreikers, Grunwald, and Pepper. Other kind of body language. Page 104 gives you some examples of things that might describe the therapeutic partnership. This playroom will work and play together. We'll do many of the things that you would like to do. Sometimes we'll play together, sometimes you'll play by yourself. If the child chooses not to discuss goals or not ready to talk about things, we can respect silence and respect the inability to verbally communicate. Demystifying the counseling process. This is where we're going to meet. This is how long we're going to be together. This is what we're going to do at the end. Bringing in consultation with parents and teachers and letting the child know that this is going to occur. Confidentiality. Explaining to the child that there are things that their parents have to know because of legal and parental responsibilities. But there are other things that can be kept private and can be a safe place for the child. And there are different ways that we can say things. We can talk in generalities versus specifics of comments and techniques that were used. Giving the child a business card, to have our phone number, to have a way to contact us. Adlerian play therapy techniques. Tracking, restating content, meta-communicating, reflecting feelings, answering questions, asking questions, returning responsibility directly and indirectly on a developmentally appropriate level. Tracking behaviors. Don't label objects. The objects that the child chooses, the metaphors, representations, or what the child thinks that they are, what they say they are. Restating the content, and then reflecting the feeling and the interpretation. Dealing with the child on the level their own, concrete or abstract. Different children, different needs. Tailoring approaches and interventions to meet the personality and needs of that child. Meta-communication, stepping outside of the interaction and communicating about the communication that's taking place to help them notice and begin to understand, to have insight. Talking about nonverbals and mood and affect. Thinking about conceptualizing meta-communication on 4 different levels. Simple factual comments, patterns, themes, descriptions of the behavior, going into reflection of feelings. I see that you seem to feel very sad or very angry, or you seem much happier today, and let the child tell you if you're getting it right. You look kind of angry when you punch the punching bag. Reflecting the feelings in simple, clear statements. Looking for underlying themes and emotions. Answering questions, not being mystical or mysterious or too adult. Can I go to the bathroom? Is it Friday or Saturday? How many more minutes do we have in here? How do you do this place? Is my mother still waiting on me? But then looking at personal questions. Are you married? Do you have any children? How old are you? Where do you live? Sometimes those questions can be answered in a straightforward manner without appearing threatened, to satisfy curiosity or need for contact and reassurance. Looking to see if those questions are to gain power or control. Relationship questions. Do you like me? Do you have other children that come in here that have the same problems that I'm having? Restating the child's experience. I see that you're wondering if I like you. And answering it. Why questions are past oriented. What delves into history. When the children chooses not to answer a question, sometimes we say nothing at all. Sometimes there's a factual communication. I understand, I see that you've decided not to answer the question. Avoid asking why. Looking at nonverbal responses, Adlerian play therapy questioning strategies. How are things going with you? What would you change at school if you could? When are you happiest at home? Open-ended questions that allow and finding selective prescription questions and returning responsibility back to the child to make decisions for themselves and the ability that they have within that connection. On page 26 and 27 and 28, there are some examples of play therapy, meta-whispering, the whispering technique. Let's play that mommy gets mad and spanks all the kids. In a regular voice, the counselor might say, you want to pretend all the kids are going to get spanked. But in a whisper, say, which one do you want me to be? And letting the child act out their experiences. Cleaning the room together. Establishing a routine the last 5 minutes as a part of terminating the session. It's not an absolute rule. If the child refuses to clean the room, avoid the power struggle. Give choices, least restrictive first. You can choose to clean up the room together, or we can choose not to play with whatever we're doing here next session or for 10 minutes of the next session. Exceptions to cleaning the room together might be if the session has been so difficult that the child is not capable of doing those things and needs just a few moments to regroup prior to going out and returning. All of these things are up to therapist discretion, but knowing when, where, and how to apply. So that is the end of chapter 5, guys.